All right, so last thing we're looking at here is just differences between active and passive range of motion. So passive is when I take the athlete through the range of motion or the position, where active is them taking themselves through the range of motion. So passive stretching or movement is always done first, where we're going to support and guide them. So for checking hip internal rotation here, I'm going to kind of bracket the knee here so we don't get excessive movement medial or laterally with the leg. We want to isolate internal rotation by guiding the ankle or the foot away from the body, and we're just tracking to see how far she can go before any pain or restrictions pop up. Internal rotation is a pretty small degree of movement. We're looking at about 25 degrees or so is optimal, and this is about where we want to see them. So then once we clear them passively, I'll have her go active. And for Nicole, go ahead and do a couple. This is about the same, which is what we want to see. What we're looking for here specifically is any kind of deficit between active and passive ranges of motion. What I'll see often is I'll be able to get somebody to about here passively, and then when I take them manual, or when they go actively here, it'll be literally like 5 degrees of motion. So all that tells us is, one, there's a very large deficit between passive and active internal rotation. And in addition to that, whether it's mechanical or whether it's a strength deficit, we want to work to try to close that margin off. Think about it like this: it's basically like having access to ranges of motion that we can't control. When we put that into action, that can present a host of problems, and it can definitely increase injury risk or potential of injury risk. So making note of where that passive point is, where that active point is, and then working to close those two. This being hip internal rotation, but we'll do that for a host of joints throughout the body.